In today's world of aesthetic medicine, there are two products which are most commonly used to correct the changes in the face. One is the Botox and the second one is fillers. Now we're going to be talking about fillers in this video. Now these are commonly called as dermal fillers, but it's not true that they're only used in the dermis of the skin. They can be used at even more depths in the skin. The most commonly used filler is the hyaluronic acid filler, and this is of non-animal source, which means it is pretty non-allergenic and it can be safely used in the face or in the body. Fillers are most commonly used by younger patients who are in their 30s and 40s and who are actually concerned about the aging features on their faces. So the most commonly used sites of these fillers are, they can be used for volumizing the cheek. They can also be used for defining or contouring the jawline and also the chin. Because of aging changes, the chin also can become a little less prominent, and that also can be corrected by the filler. And fillers also used in the temporal areas. Again, another area where you can have some amount of fat resorption as the patient keeps aging. So this is another area where fillers can be used. Okay, now we also have the fillers which can be used for the dorsum of the nose, where you can get a nice definition and contouring of the nose, and so can they be used for tip to actually rotate the tip a little above. Another very common area where fillers can be used are to volumize the lips. Again, with aging, you can have a loss of volume in the lips and thereby having inturned lips. So you can actually define the lips by giving a filler in the white roll, and also plump up the vermilion body, that is the bulk of the lip, by using a filler to plump it up. The duration for which a filler lasts, that again varies, because we use multiple products. Some of these products are very cross-linked and some of them are very dense, some of them are less dense. So the denser products will last in the body for a longer time, to as much as 2 years, and the less cross-linked fillers or the lighter products will probably last for around 9 months. Since these are hyaluronic acid fillers and these are derived from the bacterial cell wall, the allergic reactions which you would find from products which are synthesized from animal sources are very, very minimal. So no allergic reactions are there with the fillers which we use. But however, one may experience swelling, one may experience some amount of bruising if especially when the procedure, when we do the procedure and we encounter certain amount of blood vessels in the area to be injected. One may find bruising on the face, and again this is very, very temporary and it can be iced, and bruising normally subsides in 2 to 3 days. We do get patients who keep constantly asking us the same question: are Botox and fillers the same? Obviously they are not. Both these things have their role in different areas of the body, and the way they act is completely different. Botox acts in modulating the muscle. It helps in paralyzing the muscle and thereby reduces the wrinkles formed by overactivity of the muscle, and that's how the Botox acts. But whereas a filler is it's a volumizing product. So whenever there are aging changes, the fillers help in volumizing and restructuring the parts of the face or the body. Now most of our patients, they have these procedures as an outpatient, and they come in during their lunch hour, and it gets over in a jiffy. Like they can walk in and they walk out of the clinic, and the downtime, again, a lot of patients ask us what is the downtime going to be. Now when it comes to the lip, which are very, very sensitive areas, there could be some amount of swelling which could last up to 2 to 3 days. So maybe we'll tell these patients that they need to stay indoors for at least around 2 to 3 days before they can actually go into their offices. Some amount of swelling is going to be there, but in areas like the cheek and temples, the swelling is barely noticeable and visible, and these patients probably might want to go back to their offices the next day of having their filler procedure. Maybe around a decade ago, when fillers were introduced, they were purely hyaluronic acid fillers. But nowadays what we get, they come in a pack where the fillers are actually having xylocaine in them. So when you have a combination of the filler with the xylocaine, the injection process is going to be very, very comfortable for the patient. There's absolutely no amount of pain, and it gets over without any discomfort for the patient. There might be a minuscule number of patients who want to get the fillers reversed, and this is possible by using an injection called hyalase. Now this hyalase has what is called as hyaluronidase, which helps in lysing the product of hyaluronic acid, and within almost immediately, and within 48 hours, the substance is broken down, and all the swelling, all the undesired effects or areas which were looking plumper can actually be reversed. The technology of the fillers is constantly on the rise. Nowadays, not only for filling you're getting fillers, but you're also getting fillers as a booster. What do we mean by boosters? Boosters are those substances, when injected in the skin, they can cause stimulation of hyaluronic acid, and thereby causing the skin to become more rejuvenated, plumpier, and not having the look of aging, and can cause a lot of freshness in the face when these when these products are injected into the skin. So skin boosters is a new technology where doctors are actually combining the standard fillers along with injecting the skin boosters for getting the effect of a better facial rejuvenation. The aftercare following a filler injection is very simple. One is advised not to rigorously massage, not to go into extreme hot environs or cold environs like sauna, and application of ice is all restricted. Obviously smoking is restricted because it's very detrimental for healing, and these are the basic instructions which we give to our patients. And of course we give them instructions where there are red flags which can happen during the course of recovery. That is, when notices extreme pain, one notices discoloration, and one notices a lot of swelling which is happening on the injected site, one must report to their physician or their surgeon. And this is when immediate action needs to be taken to prevent a detrimental vascular event. The cost of the filler varies based on the number of syringes used. So normally, if 1 ml of syringe is used, the cost is 25 to 28,000 for 1 ml of syringe. And you can have situations where the patients will probably have to go with 3 to 4 syringes in one sitting. So the calculation is very simple. You can do 25 into the number of syringes which are used. So that's the costing of a filler. It again depends on the type of product which is used. The denser the product, more the cost. The lighter the product, lesser the cost.